Hey, how's it going? It's Dr. Jason Hahn with HealthFit Physical Therapy and Chiropractic. Joining me, one of our trusted professionals is Dr. Andy Cow. He's a dentist. He went to school at UCLA, did his dentistry degree at NYU. He did his general practice residency at Charles Drew University. Really great guy, my buddy, my dentist. I send everyone to him. So this is Dr. Andy Cow.
Hey, how's it going? It's good, man. How are you doing?
I'm doing well. You know, we're surviving with this pandemic. I know your practice had to close for about 2 months or so.
Yeah.
We've talked before, but, you know, it's been a really tough time, but you're opening up on June 1st.
Yep. Most of us, some of my colleagues have already opened. Last week or this week was their first week. I wanted to have some more planning. I think the biggest thing holding us back has been trying to get protective equipment. And so, hospitals in the States have sort of prioritized and taken all of it. There was a little thing back in April when the California Dental Association got their hands on like 1 million N95 masks. And literally they came into port, they got onto the trucks, and they were en route to one of our major suppliers, which is the dentist supply company, TDSC, for us to purchase. And it got intercepted by Governor Newsom.
Wow.
And made the trucks turn back to port. And then they took all of them and shipped them up north to Sacramento for the state. So we've been basically left out trying to figure out how to get stuff so that we can actually at some point see patients safely. So
right.
that's kind of been the toughest part.
Yeah, because your email where you announced that you were coming back, you know, you're taking a lot of precautions. Can you tell us a little bit about all that stuff that you're going to be doing for your patients?
Yeah, the biggest concern is aerosol generating procedures with what we do. When you use a handpiece, when you're getting your teeth cleaned, the concern has been aerosols and what that might spray up into the air. Based on the research and based on what I've been hearing and reading, I actually don't think it's as serious, at least my profession-wise. It seems like the infection is more serious when you're bringing up aerosols from deep down in the throat. And that's not where we work. If you're seeing an ENT who's putting a probe down your throat, if you're gathering together and doing some loud singing or yelling, that seems to be more of an issue than me drilling on a specific tooth, because you're just not seeing a ton of virus, in the upper anterior oral cavity. So, but besides, despite that, we've at the practice, like at a lot of places you've seen, we've added 2 ULV foggers to fog down the office and the operatories after any aerosol generating procedure. New EPA recommended sterilization wipes to make sure it's, going to kill COVID-19, along with patient isolation, high-speed evacuation. I ended up getting 8 air purifiers. 6 of them are hospital-grade air purifiers that was originally used by Hong Kong during the SARS outbreak in their hospitals to put in rooms. It's been hectic, gloves and face masks and gowns and you name it, UV sterilization to keep masks clean because we can't get enough N95 masks so we can reuse them effectively. It's been a headache, trying to figure all this stuff out. It's expensive too.
Right.
So everything's gone up. We used to wear 35-cent surgical masks, and now N95 masks are $4 a piece. So,
right.
Yeah, it's 10 times the cost. It's insane.
Yeah, because your place is like pretty high tech as it is. Like you have that like that 3D X-ray thing. I sat in that thing. I'm like, what is this thing? It was like moving around me. I'm like, holy crap!
We try. I think one of the tenets in dentistry is you can only, or I'm sure in all medicine and what you do, you can only do what you can see. If you can't see it, you're not going to do it, right? Like, you know what you know and you don't know what you don't know. So in this case, that's where technology comes in. It really allows us to be able to see more, whether that's, you know, the incorporation of a microscope. You know, I have a soft tissue, hard tissue, all-purpose laser that I incorporated last year. The 3D imaging device that you were talking about. So the key is not, you know, like what you do is the more you can see, the more you can diagnose, the better you can, the more information you can have before you even start. Just it's, overall, it's going to make you a better clinician.
Right. And I think one thing that I always tell um, our clients that I refer to your place is that, like, you're going to get one, good care, good service, but you're going to get a lot of knowledge. You're going to get a lot of information, because it's like you have to teach the client not only what to do, but why they're doing it. And then hopefully they brush your teeth more, they floss more. We still got to tell my wife to floss, but anyways. But
We could all do more of that.
but that's one thing I appreciate about you and everyone at your practice. You know, you take the time to educate us every time that we're in there, you know, and that's, I think that's hard to find with a lot of dentists that just, they churn people in and out, and then they, you know, they come in, out, there's really no interaction. It's just like you're a number, but it's totally different at your place.
Well, you know, I appreciate that, Jason. I think we try. I think with any profession, you definitely have to be on top of your game in what it is that you do. But especially in the healthcare field, you know, the more you get into this, you realize, you know, the more I learn, the less I know, because it just seems like that never stops. The learning never stops. And second, you know, the whole that song you learned in preschool about how your knee bone's connected to your like hair bone.
Mhm.
You know what I mean? It's like everything's interconnected. And half the time I find myself, you know, the new thing in dentistry, in medicine in general, is airway and sleep. You know, you're hearing it everywhere, whether it's on social media, chiropractors, PTs, neurologists, cardiologists, you name it. And half the time I find myself talking about, you know, PT stuff,
Mhm.
you know, positioning on how you sleep and are you, how aware are of your muscles. Half the time I find myself quoting you, you know, and, but like I said, it's all connected. And so I think anytime you're seeing a healthcare professional, they should have some sort of a broader understanding of your general health, whether it's your optometrist or your physical therapist or your dentist. You know, and that's what we thrive or we strive to do, because I think it's basically about health. Yeah, sure. If you break a tooth, here, let me take care of it. Let me put a crown on that. Let me fix it for you. But generally speaking, is your provider looking out for your overall health? That's what's most important.
Right.
So
You're not just the dentist that looks at teeth. You look at everything. Because I remember one of our first conversations about dentistry was when, before my daughter Mia was born, and we were talking about, you were talking about, what's the thing underneath the tongue that,
yeah, the freedom, the lingual freedom.
and then just how that's correlated to, or you can, I'll let you explain it, but not, like, you're not breathing enough, and then later down the line they're categorized as ADHD, but in actuality they're just not sleeping. Like, that's crazy.
Yeah, I mean, the stuff that we're learning is basically craniofacial development, and the soft tissue restricts movement, and movement and muscle tissue movement is what helps promote craniofacial growth, right? I mean, there's a reason why it's kind of like the chicken or the egg, right? So high jumpers, are they tall because they jump a lot, or are they great high jumpers because they're tall? Well, we know that it's usually a combination of the two, right? You know,
Mhm.
the genes have to be there, but in addition, you also have to train. And so not any different with growth with kids. You know, if the tongue is restricted, then the tongue doesn't get to posture in the right position, which affects mid-face growth. Then if the mid-face isn't growing, then the jaw doesn't grow. And if your upper jaw and your lower jaw is not growing, then there's no room for the tongue or for the airway, and then you don't breathe well. And then all of a sudden you're 45 and you've got sleep apnea and ADHD and heart disease, when all it takes is making sure as a toddler, as an infant, you know, you see the right clinicians, you see the right dentist, you see the right pediatrician, and you address some of these issues. Now, with that being said, we didn't know this stuff 20 years ago. We didn't
Right.
even really know this stuff 5 years ago. I mean, it's pretty new information. So it's pretty fascinating, you know. And despite that, there's still 8 billion people on this planet. You know, seems like we've gone pretty far without this knowledge. But with this knowledge, it really, I think, is going to be a huge game changer for metabolic disease. You know, if you're breathing right, it's easier to keep the weight off. It's easier to make sure you're properly rested. If you're sleeping well and you're breathing well, then you're offsetting your chances of having heart disease and diabetes. Dementia and Alzheimer's are connected to this, along with a myriad of other things. And as we're finding out with this coronavirus, it seems like the ones that are most susceptible outside of the older population are those that have metabolic syndrome, you know, or metabolic disease. If you're 25 and 100 pounds overweight, you're probably worse off than the 75-year-old who's in great shape.
Right.
So, um, you know, it all ties in.
Right. Because you're pretty on cutting edge. You always have your teams and staff, like you're going to conferences all the time. That's why I see on your Instagram at least. You know, but you're
Yeah.
always kind of learning the new stuff. Like, so let's say we're going along these lines with COVID-19 comorbidities and stuff like that. How do is there anything particular that you're looking for in your exam, or like anything you can do from a practitioner standpoint to either do something manually about it or to educate the client?
Well, I think with this specific disease, I think education is the way to go. And that's one thing I find actually surprising is that, you know, you see in the media, it talks about vaccines and antiviral medications, remdesivir and so on and so forth. But I haven't really heard a whole lot on a broad spectrum of just trying to get healthy,
Right.
losing weight, going out and exercising. You know, we've got gyms shut down. They're closing down these beaches. And I get it. You need to socially distance, but people need to stay active. I mean, my office has been closed for over 10 weeks. You know, if you were being, what's the right word, diligent about it, you could have lost 20 pounds in these 10 weeks by eating healthier and exercising and giving yourself a better fighting chance, God forbid, down the road, if, you know, you do catch the virus. But just in general, lifestyle. I mean, you know, I'm not trying to politicize anything, but we've moved in a direction where, you know, when you want someone to be healthy, you have to be so careful about it because you don't want to be accused of fat shaming someone or just being politically incorrect, when all you're trying to do is say, hey, you know, in your best interest, losing some weight and exercising and eating healthier is good for you. I mean, they advocate, as for my profession, to get patients to quit smoking, but God forbid we tell someone that they should lose 10 pounds or exercise a little bit more because that's inappropriate. And I just don't understand the discrepancy or the, you know, the difference between the two. I mean, if you're healthy, you're healthy. If you're not, you're not. So it's an overall multifactorial issue. So I mean, you're involved in it. Your physician should be involved in it. A dietitian should be involved in it. Your dentist should be involved in it. You name it, right? But my part is to really talk to patients about that. And in dentistry, you can see, you know, patients who have inflammatory disease, you know, it manifests itself in the oral cavity. You know, whether they have uncontrolled diabetes, they're overweight. You know, they say, oh, my gums always bleed, or I always get cavities. You know, no matter what I do, it seems like I can't control this. And then you find out all they eat is sugar all day. Well, you know, not much we can do about that. If that's what you're going to do, it doesn't matter how much you brush your teeth. You hit the K, you know what I mean? So it's a lifestyle change
Right.
that'll improve all aspects, whether it's you've got back pain or bursitis in your knees or gum disease. You know, you get healthier and all of that seems to get better.
Yeah, because if you think about it, you're a dentist, I'm a physical therapist, but we're categorized as healthcare professionals. So we should be looking at it from a, you can call holistic view as much as you want, but that's the thing that's been happening is that, yeah, you're so focused on masks and medication and isolation, which is not wrong, but it doesn't correct the underlying problem of maybe you have all these comorbidities, and then how can you make those better? Like, how can you walk 10 more minutes than you're used to? That's going to put you on a good trajectory. How do you eat a little bit better? You know, it only, like, I don't even know what the statistic is, but even if you eat 2 or 3 good meals, your blood sugar automatically will go towards where it's supposed to go.
Oh,
So
absolutely.
it's like, it's about looking at the big picture, and then correcting it from there. So, you know, I totally agree with you. We could talk about this all day, but so we're gonna backtrack a little bit. Let's talk a little bit about, like, your practice and how you took it over from someone else. How long have you had it?
Yeah, no. So I graduated dental school in 2003. And some of you may know this and some of you may not, but dental practice in the United States, about 55% of them are corporate owned, meaning they're not owned by a dentist. And they just hire people to work for them. And those are the mills, those are the Western Dentals and the Newport Dentals that you see, where you walk into the office and there's like 18 people in the waiting room and they've got 45 patients on the schedule per provider. And it's just, it's like you walked into, the Burger King of dentists,
Right.
and they're just feeding people. And so when I came out, when you're a new dentist, those are the places 99 times out of 100 that are hiring. And so pretty quickly, 6 months in, 12 months in, I realized this is not dentistry. This is not healthcare. I have no interest in doing this. If you're lucky, you're just being burnt out. If you're unlucky, you get into a practice that's committing malpractice, drilling on teeth that don't need to be drilled, over diagnosing, upselling, all that kind of stuff. Not any different than a used car salesman would be.
Right.
Not to bad used car salesman, but so, you're out. I realized really quickly that this is not what I wanted to do. And so I either needed to find a good practice to join, or start my own practice and build it from scratch so that I can actually do the kind of dentistry I wanted and take care of people the way I wanted to. And literally, like within a month of having that thought, I ended up meeting a dentist at this place that I was volunteering at that was looking for an associate. Turns out it's the practice that I'm in now. He's been in Pasadena since 1957. I met him in 2004, and it's a family practice. We've got third and fourth generation patients in the practice, and it's really about taking care of people the right way. It's about their health more than anything else. And so we worked together for like almost 9 years. I bought the practice from him in 2008, and he worked with me all the way through almost 2013 when he retired at the age of 80. And he'd been in practice for 55 years. Most of the staff stayed on. Some of the staff members who've been working for him for years, who had a long commute, ended up, retiring because they really stayed on for him. That was the kind of guy he was, or is, I should say. And kind of long story short, I've just been trying to make sure that we continue the legacy that this practice has built, over the last 6 decades, of making sure we're taking care of people the right way in San Gabriel Valley in Pasadena.
Right. What are some of the, obviously, like, throughout this pandemic, like, financially it's been hard on all of us, but I think even more so for us here is, like, our clients, not having them around, not having that interaction, it has been just as hard. What kinds of messages and stuff have you received from your clients while you guys have been closed?
We've had a handful of emergencies every week, and I was going in once a week to see emergencies because we were still allowed to do that. Put off most elective work, anything that would generate aerosols on a large scale, until we can get more PPE into the office. But patients are excited to come back. They're looking forward to taking care of their health, and I think that's one of the upsides of building a practice where you have your patients, best interest in mind. Their health is the most important thing. They realize that, they understand that. They understand that you're going to do everything you can to make sure they're being taken care of and helping them stay healthy. And so, I'm seeing a patient next week that's coming in, and when I was talking to him, a little joke about what to do, what not to do, and how uh, if things were to go wrong, in a court of law, the prosecutor would say, so you're just a dentist. That's a little joke. You talk about healthcare, you talk about something about medicine, and they go, yeah, but you're just a dentist. And the patient was kind enough, and he responded by saying, yeah, that's what they would say, but I would never say that because I know you're not just a dentist. And that was really put a smile on my face. That was heartwarming because that is, I think, the most important thing. You're not just a physical therapist, and so on and so forth. Because sometimes they come in and they just want to talk about family problems or where they went on vacation last week. I have patients who ask me about like things. I'm like, I'm just a dentist, right? Like one of my patients a few months ago came in and with trigeminal neuralgia, and she's been on medication, but it was over the last 5 years steadily getting worse. And so they said that, one of her options was to have surgery. And the neurologist, the neurosurgeon was recommending surgery. And she wanted my opinion on that. I said,
Right.
I appreciate your confidence in me. I'm not a neurosurgeon. I couldn't tell you, what the right route to go is. But that the confidence that they have in me and my practice has been at times, just it's overwhelming. It's an honor to say the least. I mean,
Right. I think I appreciate that because it's like the best relationships are when there's trust. And then like part of what we've done over time is like, me and you, we have this network. So like I've called you and asked you questions about, this and that regarding a patient. It's like, is this something that goes to you? Should I call someone else? And like, because if they didn't have me and you to talk to in the first place, like they don't have anyone to talk to, and they're just so at least we can help even in the areas that we're not the professionals in because we have a network of people. So
yeah,
that's pretty cool.
and you also have to have some sort of an understanding, a broader understanding of health, right?
Right.
They might ask you a question. You're like, well, actually, I think that's the realm of a dentist that you should go see, or maybe that's the realm of a facial pain specialist that you should go see. I can't tell you the number of this patients I've sent you who come to see me for pain in their ear, or I've got these sinus issues. I'm like, actually, I think it's something chronically that you've been doing for all these years that's added up. It's catching up to you. I've got this great PT you should go see because it's a lifestyle change. It's a positional change. It's as an antidote, like when I sent my wife to go see you,
Right.
she's had neck problems. She was a teenager. And after her first visit with you, she came home and you said, you told her, you're not using your shoulders and your upper back enough. You're using your neck a lot of times to do things. And that's why you've got these chronic neck issues from time to time. And then she came home literally like 2 hours later, she was making some eggs, and she realized she was craning her neck to beat eggs. She's like, why am I craning my neck? This is stupid. Sometimes it's just awareness of things.
Right.
Thing.
She really want to make those eggs. That's why.
Yeah, seriously. Yeah, the things that we do, we don't even realize.
Right.
That's
Yeah, like you said, awareness, education, right? Like, hey, you need to floss because of XYZ. Kelly, my wife, needs to floss. Anyways, but so what's one of the biggest things you're looking forward to, like stepping back in next week?
Just a bit of normalcy in this craziness. I think the main reason why we shut down, why the world shut down, our country shut down, is to protect those who are vulnerable. But a large part of it too was, I think, the unknown. We didn't know whether this virus killed at a 0.2% rate or a 6% rate. We didn't even know how it was doing what it was doing. I think some of the newer data coming out were saying that, we had everybody on ventilators, but yet 9 out of 10 patients were still dying because it wasn't a ventilation issue. Um, and so a lot of it was unknown. So I'm looking forward to going back and practicing dentistry and taking care of my patients, having some sort of normalcy, of course, with all the proper precautions, and just really, making sure that we can be there to take care of our patients, so that
Right.
they don't develop a major abscess and end up in the ER and overtaxing the system. Doing our part.
Right. Absolutely. All right. So let's do a little bit of going back to your, not your childhood, but your 18-year-old self. If you could go back and give yourself some advice, one piece of advice, what would it be?
Um, Gosh, probably two pieces of advice. One would be, Mickey Rooney said this. If I knew I was going to live this long, I would have taken better care of myself. So tell your 18-year-old self that you're not immortal, and you don't push the body so hard, because at 45 or at 65, your knees might not appreciate you for it, or your neck might not appreciate you for it. That would be one piece of advice. And the second one probably would be that you're not as fashionably in tune with things as you think you are.
That's
Probably
fun.
those two. Yeah.
At the time you were.
No, not really. Looking back, not really.
Hey, look at you now. You're all good, dude.
Yeah. T-shirt, and I'm good. That's all I
Exactly.
need.
Last question. If you could have dinner with any three people, dead or alive, who would they be and why?
Wow. That's a tough one.
Or give me two.
No, I can give you three.
Okay.
I can definitely. The first one would be Michael Jordan, because
Okay.
I think out of all the athletes in my lifetime, there's been nobody who is, and just with the new documentary coming out, The Last Dance, reminded me, like, he was just, there's nobody ever like him. I mean, there's very, very few people that were that transcendent as an athlete.
Mm-hmm.
And I would love to just sit there and hear stories. Number two would be President Obama, because I think, not only was he an amazing president, but just what he had, his personal experience in the White House was probably pretty dramatically different than every other president we've ever had,
Right.
for a myriad of reasons, with the recession to race to, you name it. Um, those would definitely be two. The third one I'd have to think about. Maybe Mother Teresa.
Okay.
For someone to dedicate her entire life and to have lived as long as she had, to doing that much, to be that giving is pretty incredible. I mean, that's just mind blowing what she did
Yeah,
in
to
her
have
lifetime.
to be so selfless. Oh,
Yes, that's
oh, like how do you
incredible.
like you even like reflect on yourself? Could I do that? I'm like, no. All right, man. So I appreciate you taking the time. Um, how can people find out more about your practice? How can they contact you guys?
Well, I have a website, but my website's mostly just informational in the sense of where to find us, and how to get a hold of us. I'm not a huge social media guy. I've got, I do have a practice consultant who said I need to do some more of that, but it's kind of not in my DNA. The best thing to do is to call the practice, or to speak to some of my existing patients. We have a pretty good following on Yelp, at least we did, with some really good reviews, and we've had some very kind patients say some really nice things about us on Google reviews too. But mainly come to the practice, talk to the staff, talk to my existing patients, to really get a feel for what we're all about. We're really about you, the patient. It's a patient-centric practice and whatever is in your best interest, whether you like to hear it or not, is kind of how we approach things. We want to make sure that, one of the ways of saying it is that, we're not here to do things to you or for you. We're here to do things with you. Um, you know, I'm here to make sure we can get you into the best health possible, whether that's with a referral or with what we do. And that's our primary goal, is to make sure we're taking care of you guys at the highest level possible.
Absolutely, man. All right, man. I appreciate you taking the time.
Hey,
It looks
thank
like,
you, Jason.
it looks like is it getting cloudy over there?
It is, man. It's getting a little cloudy over here. So, yeah,
But
still, still warm. Can't complain.
awesome. Well, I appreciate you. I'll see you next week. And then, again, I'll link all of Dr. Andy Cow's things. And then, if you're looking for a dentist, not only just a dentist, but someone that's truly going to take care of you, you got to reach out to this guy. So
Right.
Thanks, man.
All right. Enjoy. Thanks, Jason.
Take care.
All right. Bye.